Hey everyone, welcome back to Medicine in the Making, where medicine meets meaning and future careers come to life. I'm Maya, your host, and in each episode I sit down with rural healthcare professionals to give you guys the behind-the-scenes look of what it's really like to work in the medical field. And today I'm so excited to welcome Dr. Angelique Redus-McCoy to the podcast. She's a general pediatrician with over 2 decades of experience, and she's currently serves as an associate program director, where she helps shape the next generation of physicians. Dr. Redus-McCoy earned her bachelor's degree in biology from Spelman College, then went on to earn her medical degree from Case Western Reserve University. She completed her pediatric residency at Children's National Hospital in Washington, D.C., and ever since, she's been deeply involved in both patient care and medical education. Beyond the clinic, she's passionate about community-engaged pediatrics, mentorship, and creating space for more representation in medicine, especially for those who don't always see themselves reflected in the medical field. Dr. Redus-McCoy, thank you so much for being here, and I can't wait for the listeners to learn more about you and your journey.
Oh, thank you so much for inviting me. I'm honored.
Of course. So my first question is, what inspired you to pursue a career in medicine, and specifically in pediatrics?
I would say for medicine, probably the biggest inspiration and the most direct one was one of my guidance counselors suggested in high school, I think between 11th and 12th grade, that I apply for a summer research program at Case Western that was specifically for underrepresented students. And at that point, I was kind of like all over the place. I thought I wanted to be like a sociology professor. I really liked biology, but I wasn't really thinking about medicine so much. And interestingly, she was actually one of the only Black educators I had from like going through like elementary school and high school. I never had actually a Black female teacher, and so like she and I just bonded really closely with her as my guidance counselor. And I did this program, and I think from the moment I stepped onto the campus at Case Western at the School of Medicine, got into the lab, and then I met another like amazing like MD PhD Black woman physician scientist, and I was just like, this is where I was supposed to be. Like it just felt like me seeing my future in a way. And so that moment, I think, was the first big spark for me in terms of going into medicine. And then for pediatrics, interestingly, I wasn't really thinking pediatrics, so went to Spelman College, and I was really passionate about women's health and just women's empowerment overall. And I went into medical school the first 2 years and some change, actually thinking that I was going to do OBGYN. I was, really enjoyed work that I had been able to see at that point. But then once I did my first core clerkship, which was in pediatrics, I felt like myself, like I felt I could be myself. I felt like I can, my voice is kind of high, I was kind of silly, like things like that. I could bring that to medicine too. And then I went through the rest of the year until I got to OBGYN to confirm, but in my heart, once I went through that rotation in peds, I knew like that was where I was supposed to be. I enjoy working with not just the babies, but the teenagers. And I really enjoy working with families and helping reassure them, helping educate them. And so just it was like the total package.
What did you major in college, and do you think that helped shape your journey into medicine?
Sure. So I majored in biology. I'll be honest, I didn't really know that I could major in a non-science. Like I went into medical school not having like that kind of background, like that kind of understanding and mentorship to say like you can major in theater and be pre-med, or you can major in Spanish and be pre-med, or you can major in all, in literature. Like you could do all these other things. There were lots of other things that I liked, although I did again love biology. So I do think biology helps. I think, my requirements for my major were great. In retrospect though, and I don't do regrets much, but I do feel like it would have been cool to have majored in something else. Like I said, I really loved sociology. Like I thought like that probably could have been my major, and I could have still been pre-med and gotten through the prerequisites. But I loved biology. We had amazing professors, really wonderful mentorship there. And so, it's not a big regret. It's just a little regret, but biology was great, but I do think it's important for students who are moving through the process to know that they don't have to major in a science. It's not required.
Can you also walk through your full educational path and from college to medical school?
Absolutely. So the first, couple years at Spelman were kind of like those core science courses, with biology, general chemistry. I think microbiology was within those first 2 years or so. Botany even, which I remember because our professor was really cool. And also other courses, so I was still taking English. I still took a few sociology classes actually because I enjoyed them. And then eventually moved into some of the, what arguably could be even more challenging courses, like organic chemistry and physics, which I got through, and I think I had to take a little bit of calculus to wrap up what I had done in high school. And those were kind of those core things that were required for like thinking pre-med as well as kind of getting through the major. For me, I actually was a solid student. I was not like an A+++ student, but I was a solid student. Again, better in bio than maybe I was in chem. Organic chemistry, which is kind of classically known as a challenging course in the pre-med process, was a little area that I didn't do as well in. And so I will say though, one of the things that I learned from that experience, because I was making my schedule, I talked to my advisor at Spelman, and she was like, listen, you're taking a lot of classes. I can't remember all of them. I think it might have been like physics and organic chemistry and like molecular and cellular biology. She's like, that's a whole lot. That's a huge load. I would suggest maybe taking one of those off. And I was like, nah, I'm smart. I can do it. And I went ahead and did it, and I couldn't do it. Like, and it wasn't that I wasn't smart enough. It was just the breadth of the work, the depth of the work, the volume of the work that was just too much. And so I actually got to a point where I would have probably failed organic chemistry, actually. And so I withdrew my first semester, which is not like, ideal, but I withdrew before I got the poor grade. Did well in the other classes and retook it, and actually got I think I got a C for the first part and then like a B for the second part. So I did okay. It wasn't like my best, but I did okay. But it was really important, it was a reminder for me, the people that advise us, although their advice may not always be perfect, she was right. Like, I really couldn't have handled that. But moving through that process, I, learned a lot from that, dug into like physiology and all those other wonderful courses, which I enjoyed a lot as well. And then started kind of like the traditional path to applying for medical school. So I took my MCAT. I kind of came from resources that weren't like super robust. Like, my family, they did a lot to support me. My dad worked a lot of overtime. I did not have money for a course at the time, which I know a lot of people will do, which I think is wonderful when you can. But my dear friend actually lent me her books from her course. And so I used a lot of her MCAT prep books to study for the MCAT for med school. Took a lot of practice tests and got a lot of support from our Health Careers Club at Spelman as well. And I did pretty good. Like, I wasn't, again, maybe not A++, but it was like, B+ level type of MCAT score. And I applied, was really, really fortunate to get into a few schools in my state. So one of the things that is still, I think, the case to a good extent, although definitely med school, I think the application process is a bit more competitive now, is that oftentimes your state schools will look at you a little bit more closely if you're a resident of that state. And so being from Ohio, I applied to all the schools in Ohio. I definitely applied to other schools as well that I was interested in, other cities that I was interested in. I can't remember the exact number of interviews that I had, but it was a decent number. So maybe like 8 or 9 or something like that. And then I got accepted, was really fortunate to get accepted to multiple schools in Ohio and at least one other school outside of Ohio. And so I was blessed to have options when it came to choosing where I wanted to go. And from my experience as a high school student, and I had actually had a summer pre-med program experience while I was at Spelman at Case Western. It felt like home. The mentorship there, the dean of students there at the time, Dr. Pammies, who since passed on, but he was amazing. And it was close to my family. And so I felt like that just made sense. And so I made my way to Case. Back to Case, I guess you could say, in a way.
Now that you went through all of that schooling, what does a typical day look like for you?
So now, a typical day for me is kind of split up. So I have maybe 3 days that are mostly clinical days and 3 days that are mostly admin days, which I like. I enjoy that. So right now I am in clinic, the equivalent of 2.5 to 3 days a week. And so we count half days as sessions. And so I'll have about 4 sessions or so. And I see patients on my own schedule, meaning my own personal patients, the ones that, I'm their doctor. Dr. Redus-McCoy is their doctor. And so I'll see a combination of kids all the way from birth, the ones that come and see us right after they get out of the nursery, who are maybe 3 or 4 days old, to the ones that are, about to go to college or in college sometimes even. And so I have that really cool range of patient ages. We'll see them for well visits as well as for follow-up visits, or if they have an acute illness, we'll see them for that. I'm in a teaching clinic, so I work in a teaching clinic since we're in an academic center. And so usually at least one of my sessions of clinic is supervising residents. And so they will see their patients and then I will supervise them. For our more senior residents, I don't always have to go in the room, but we could discuss the patient and kind of supervise in that way, kind of indirectly. And they'll just call me in to see something, if it's something abnormal, significantly abnormal on an exam or a concern about like the counseling that the patient needs. For our first year residents who just started, like literally like this week, this is their first full official week of residency, we have to go in obviously, which makes sense. And so we go in with them, see the patient ourselves as well, do the exam as well, and help kind of collaborate on the plan until they become more senior in their training. So I love patient care. It's, despite all the other cool things that I do, that's the core of who I am as a pediatrician. Just really enjoy like making connections with families, having my patients grow up. I have a few grand patients, as we call them. So patients who have grown up, had their own families, and then they bring their babies to see me, which makes me feel old, but it's cool. And so, yeah, love patient care. The other side, though, is the associate program director role. And so that's where I meet with residents. We have like some scheduled meetings, and then we're just present just to help troubleshoot issues that they may be having, whether it's as it relates to career planning, if they're interested in doing some like further training as a fellowship after residency, if they're having just like personal issues that are impacting how they're doing at work, if they're having challenges just like ethically where they're like thinking through scenarios and they're just not sure, like as they develop their professional identity as a pediatrician, how they want to address things. And so it's kind of everything. It's personal, professional, and where it all hits each other. But that part of my job I love, because at this point in my career, I just want other people to do well. I want to do my part in helping young doctors soar. And so it's a really beautiful space to see that. And when they do go off into the world and do their thing, and I can say like I had a little teeny bitty role in that, that makes me feel really proud, but more proud of them because they're amazing.
Do you think working with kids from birth till when they grow all the way up affects the care that they receive?
I think so. I think the relationship part is huge. There definitely have been some families that, you know, I will see them again essentially from birth and onward, and I've gotten birthday party invitations and like graduation cards and all these really cool things, because you do kind of become like an extension of their family. I oftentimes share with the residents that one of the best compliment that I ever have gotten from a family is from a mom who was like, you know what, Dr. Redus? And this time I think I was just Dr. Redus. I don't think I was married yet. But she was like, you are like, not even like the doctor sometimes. It's just like you're like an auntie that knows a lot of stuff. And so like that to me meant like, I'm like her family. Like she trusted me like she would trust a family member. And so that part is lovely. I think being able to like also like grow in terms of the depth of the relationship and the trust part. Sometimes I meet families and maybe they've been somewhere else for a while, and maybe they have a little hesitation or a bit mistrust, which very often is very much well earned in medicine. Not everything that happens in medicine is great, and so they come in kind of leery and a little hesitant. And to be able to build trust over time is important. So if I see someone just once and I don't see them again, and then they see different people every time, they're not really given a chance to build trust. And so being able to see families year after year after year, and you deepen that relationship, I think you really do develop a stronger partnership and a stronger sense of trust, which I think helps them, helps me be a better resource for them as they're making their medical decisions.
What do you think the most challenging part of your job is?
The most challenging, I think it depends on the era that I've been in as to what's been most challenging. I would probably say there was a time, like when my children were younger, my children are teenagers now, but when they were younger, like kind of balancing like the attention that I gave to work and the attention that I gave to home. And so I had to make some difficult decisions at times, which at the end of the day weren't that difficult. It just took me to make the decisions. When my daughter, for instance, had like some medical problems as a baby, and I had to just like stop working for a while. Like I actually had to stop. I was like, you know what, I was in a space where I was like in a leadership role, and it wasn't giving me the space to be there for her, and so I needed to do that. And then things kind of settled down over time, and I kind of could dig in more to work. And then even now, like as being teenagers, realizing like the need for me to be present is really important too. And so while it's a challenge, but I think I've grown and matured as a parent to know like family is going to come first and work is going to come second. So whether I'm going through issues with my parents as they're getting older or with my kids, like at the end of the day, work has to be second. And so that might mean that I might not get, all the big projects or all the big awards and all that other stuff, but that's okay. That I'm very comfortable now with that and just accepting that, at the end of the day, me as a human is more important than me as a doctor.
And I can tell just by the way you're speaking how much you love your job. So what do you think the most rewarding part of your job is?
It's twofold. It's definitely the patient part, just watching kids have I think the breakthroughs are really cool. Like I had one patient who she wasn't feeling me. She was like, we met and she was like maybe a young teenager and the parents were having some issues and she was having some behavior issues and it was just tough, and I wasn't feeling like I was making any headway with helping her get to a better place with her issues. And then one day I was about to go to her room, but I had to walk past first, and she was smiling. I had never seen her smile, and I backed up, and I was like, "Oh my goodness, girl, you're smiling!" And those moments, when you again, that's that part of having those longitudinal relationships in primary care for me, which is why I enjoy that type of relationship, because I can remember her not wanting to talk to me and roll her eyes at me, and then some months later she's smiling and she's able to open up and talk more candidly about things. So that for me is priceless, just being able to connect and help people get through tough times. And as I've seen patients over the years, now that I've been practicing for a long time, when they come back and say, I was really listening, especially the teenagers, when I saw them as teenagers, and they're like, I really was listening. I know you didn't think I was listening, but I tell my little cousins, things that you told me, and I just want to, say thank you. And so that, again, when at the end of the day, when I look at my CV and all that stuff, those other things are fine, but to be able to have impacted someone's life is in a positive way, even if it was a small positive way, is the part that's the best.
And I know as a pediatrician, you have to work with so many different kinds of kids. So how do you usually handle situations where kids are scared or nervous about a visit?
Yeah. I think what we learn is try to read the room. Got to be really, have some good emotional intelligence, have some good situational awareness. If you come into the room and the kids are running over to you and giving you a hug, you haven't even said anything but hi, that visit's probably going to go pretty easy. Whereas you've got the other little ones that sometimes you walk in and they're crying as soon as they see you. So I usually, in instances where either the patient's clearly a little nervous or is a toddler and they're just crying, I try to sit down. I try to shrink myself a little bit so I don't seem intimidating, even though probably don't seem that intimidating to that many people, but for the little one you can. And just kind of meet folks where they are. And sometimes the families are stressed and they're looking nervous or they're looking sad. Similarly, I try to sit down and just kind of lean forward and just tell me what's bringing you in, and just let them talk. And so kind of just getting down to the level of whether it's the parent, and definitely with the child, just trying to get them to a point where you can emotionally connect. But those little ones that are just mad, are scared, we'll bring little things in. I have a little Lego light that I, light up sometimes, and sometimes that intrigues them. I'll play little peekaboo games that'll sometimes get them a little lighthearted, and get them to lighten them up a little bit. We use books. We use books as part of our visits to disperse, as part of kind of early literacy promotion. That sometimes I'll read a little bit of the book or point to things in the book, and sometimes the ones that aren't too revved up, we'll kind of kind of bring it down a little bit. The ones that are just crying, I just tell the parent it's okay, because oftentimes the parents are apologize, and I'm you know what, they're a kid, that's what kids do, and I just I'll just work with them. So we just move around, they pick them up, and I just listen to them as I can, and then usually I'll just go back and sit down so that I'm not right up in their face, so that they can try to relax. So I'm used to the cries. I'm used to the kids being nervous. Again, that's just kids being kids, and that's I don't expect anything different, and it's okay. So my job is to just make sure the family knows it's good. I got you either way. And then over time, the kids usually get more comfortable.
How do you usually play a role in the long-term health of these kids?
I think one of the things that I really love about peds is that like oftentimes we'll start with a baby who can't communicate, but then even as young as 3, 4, they can start to like ask questions and tell you stuff. And so by the time they get to like grade school age, I really try to like kind of do like a little summary of the visit, and I asked them like what they learned and what things are they going to be able to do to stay healthy, and what things are they going to do to help their family stay healthy. And so kind of giving them like showing them that they can like make these decisions and that they have power in terms of their wellness, I think helps them like start to take ownership of their health even as a kid, and then continue to grow on that as they get older. For teenagers, we usually will do part of the visit with the parent, and then let the parent know that we give them some space to ask questions alone, and a good portion of that is also for them to take ownership of their health and to ask questions about their body and their feelings or how they're feeling mentally. And so just giving them space like to own what they're feeling and what they're worried about is important. So which I hope, and I always tell them like the goal is for them when they go off to like adult medicine that they'll have practiced that we've been able to practice that in a safe space, and they can go and handle their business moving forward.
Are there any common conditions that you usually treat in pediatrics?
Thankfully, a good chunk of children are really well, and so a lot of my patients are generally pretty healthy kids. I would say the most common chronic illnesses would be things like asthma, maybe allergies, eczema. Those all kind of go together oftentimes. ADHD, like maybe some other like learning issues, but definitely ADHD. We do see a lot of mental health issues in pediatrics, and so from anxiety to depression, developmental issues like autism, and then we'll have some kids that have kind of lifelong or very long standing like chronic illnesses. So whether it's like inflammatory bowel disease, which is not super common, but a few patients with that, for patients with sickle cell anemia. Luckily, kind of the scary things like cancer, things like that, we don't see often. But I have had a few patients over the years that were diagnosed with cancer. So the more chronic things or the more serious things, thankfully, we don't see a ton. Thinking of others, like maybe like congenital heart disease. I have a few patients that have like different types of congenital heart disease. What else? Seizure disorders. So, working through families, and thankfully a lot of those conditions have like different chapters. Like they may go through the chapter where if they do require surgery for a heart condition, they have their heart surgery. And oftentimes, depending on what that was, they can do well moving forward. If they have seizure disorders, some seizure disorders kids actually outgrow. And so you kind of work with, family, work along with the pediatric neurologist, and follow them kind of together. And if they don't fully outgrow it, just ensuring that they're managing it okay, that we have plans for school, that they are on appropriate medication, things like that. So those are definitely I would say more well children, and then kind of the kids that have those long-standing issues are kind of next tier. And again, thankfully a lot of them, will do really, really well just with kind of like the co-management with their specialists.
Are there any important traits you think are needed to work in a career in pediatrics?
I definitely think you gotta be pretty kind, and you gotta be able to connect with kids. Kids are very honest, and they don't let you get away with not being on your stuff, and so and they can tell if you're just not genuine. And so you gotta just be real. You gotta be comfortable talking with them. You gotta be humble. Gotta be a little vulnerable sometimes, because again, they will call you out. But I think really just going in and being a kind person, being someone who just wants to give voice to kids, likes hearing about kids. My daughter teases me a lot because I'll come home, and if I'm looking on social media and I'm looking at Instagram and watching these little baby videos, she's like, "Aren't you tired of looking at babies?" I'm like, "They're hilarious." I think stuff that kids do is funny. So I get joy out of working with kids. And so I think for people that go into pediatrics, you have to genuinely like being around children, because you're going to be around them all the time, whether they're well or whether they're ill. You need to be able to genuinely enjoy being around them, and not everybody does, and that's okay. But for peds, it's important, because again, they'll be able to tell if not. And then I think you just have to be really patient. You have to be patient with your patients themselves, but then also with their parents as they go through, times of being worried and times of being anxious about what's going on with their child. Particularly when things are actually okay, and what we would call the worried well, when a family has worries but their child is actually okay. You have to be really patient to be able to have that conversation. You don't want to be dismissive. You don't want to brush stuff off. You actually want to be able to let them express what they're concerned about, and then step by step get them to a place where they're more comfortable, and then you can help alleviate those worries. But that takes a lot of patience to be able to do that.
And then my last question is, what advice would you give to a high school or college student who's interested in pediatrics but unsure about their path?
Sure. I would say, honestly, just do things, experiences, definitely, pre-medical type experience or pre-health experiences. I know that there are some that are available for high school students, definitely lots that are available for college students as well. And so whether it's working in, shadowing in a pediatrician's office or with someone in the hospital, whether it's in the NICU or the emergency room or something like that. If you are doing research, even if it's not so directly facing kids, oftentimes physician scientists that do research will oftentimes have clinic too, and so you can do the research, but then you can also get to see how maybe some of that research plays out in a clinical setting. So definitely looking into those. And then just doing depending on what one's interest is, if someone's interested in community engagement, a lot of the work that we see pre-medical students do and ultimately medical students may not be full out medical, but it can be going to a high school and working with kids in their science class. Even though again it may not have exactly to do with medicine, but it's a way to inspire kids, engage with them, maybe do some education around health and wellness, or if it's summer camp and doing sports and things also again related to wellness, but maybe not purely medical. Just spending time with kids, spending time in service to kids, whatever that may look like. Because when you think about it, pediatrics is taking care of the whole child. So whether it's taking care of them as a student and where they are in their schooling, if it's taking care of them as it relates to their mental health and their emotional health, emotional wellness, or if it's more their physical health, wherever you can have a touch point with kids, I think is important if you're interested in peds. And then just kind of growing with your passions for folks that are interested in school advocacy, partnering with schools if there are ongoing programs that are going on. I've had medical students who've gone through the application process who have done teddy bear clinics and things like that, where they go and teach kids about the physical exam with teddy bears. It'd be a third grade class, stuff like that. Just finding ways to do the things you love and continue that work. Another quick example is one of my med students, actually, who is now a physician. He just graduated. He coached Little League and youth basketball in pre-med, and he really loved it, and amazingly he still managed to keep doing it as a medical student. And that was his way of just staying connected to kids, just staying, being a mentor in a lot of ways, and being just someone who can be a resource, kind of part of their village, part of their community beyond their family and their parents.
Well, that's all the questions that I have today. Thank you so much for joining. Absolutely. It was my pleasure. And thank you everybody else for watching Medicine in the Making. I hope today's conversation gave you guys a little bit more clarity, inspiration, or motivation into your journey in healthcare. And if you liked what you heard, please follow the podcast, leave a review, and share with someone who might need it. If you want to find more updates, guest highlights, or behind the scenes moments, follow the Instagram at Medicine in the Making. And until next time, remember to keep dreaming big, keep learning, and remember that the future of medicine starts with you.